careful. There are 5 threatening season diseases. The transition season can be a threat to health. Why not? A series of diseases can appear in this season. There are several diseases of the transition season that need to be known. If not handled properly, this seasonal transition disease can cause complications that harm the body. The transition season is the transitional season between the dry season and the rainy season. This season is generally owned by countries with tropical climates, including Indonesia. This season is usually characterized by high rainfall, strong winds, and others. In this season too, many people fall sick. In the transition season, changing weather will change air pressure, temperature, and air composition. This condition is an ideal place for germs to breed. 1. Dengue fever. The high rainfall causes a lot of stagnant water, which is an ideal place for the Aedes aegypti mosquito to breed. Aedes aegypti is a mosquito that transmits dengue hemorrhagic fever, DHF, through its bite. Quoting the Mayo Clinic page, on a mild scale, DHF will trigger flu-like symptoms accompanied by high fever. Meanwhile, in severe forms, dengue can cause serious bleeding, a sudden drop in blood pressure, and even death. Here are some symptoms of dengue to watch out for. High fever, can be up to 40 degrees Celsius, headache muscle and joint pain nausea and vomiting pain behind the eye rash or red spots. 2. Diarrhea. Diarrhea is also one of the diseases of the transition season that needs to be watched out for. Generally, diarrhea can go away on its own. However, in acute conditions, diarrhea can occur for more than 1 or 2 days. Some cases even occur in a matter of weeks. Many things can cause diarrhea. According to Healthline, this condition is generally caused by a rotavirus infection. The form of watery stools is one of the main symptoms of diarrhea. In addition, diarrhea can also be characterized by nausea and vomiting, stomachache, bloated increased bowel movements. Diarrhea cannot be taken lightly because it can cause the body to lose a lot of fluids, which can lead to dehydration. This condition will cause a number of symptoms such as fatigue dry mucous membrane increased heart rate headaches and dizziness. Increased thirst. The intensity of urination decreases. Dry mouth. 3. Influenza. Influenza is an infectious disease that attacks the respiratory system. This disease is caused by a virus that infects the nose, throat and lungs. Quoting the Center for Disease Prevention and Control, CDC, page, influenza can cause a number of symptoms such as the following: fever, cough, sore throat, runny or stuffy nose, muscle and joint pain, headache, feeling weak. 4. Chikungunya. Just like DHF, this disease is transmitted through the bite of an infected mosquito. Quoting Medical News Today, this disease is basically rarely fatal. However, symptoms can last a long time and make a person feel very weak. Chikungunya symptoms are similar to dengue. Here are some of them. Fever, sometimes reaching 40 degrees Celsius. Joint and muscle pain. Headache. Rash. Swelling around the joints. This disease can also be accompanied by other symptoms that are relatively rare, such as conjunctivitis, nausea, and vomiting. 5. Respiratory tract infection, ARI. ISPA is an infection that occurs in the respiratory system. According to the National Health Service, NHS, page, this disease can be transmitted between humans through droplets of infected people. There are several types of ISPA that need to be known. In the upper respiratory tract, RE generally takes the form of flu, sinusitis and sore throat. Meanwhile, In the lower respiratory tract, RA can take the form of bronchitis to pneumonia.